Teresa McCabe is here from WVU Medicine. Teresa, good morning to you.
Good morning.
One of you guys are going to turn your phone off. What is this, the House of Horrors this morning?
It's not me. Mine is on silent.
Yeah, I know it's not you, Teresa.
I don't think it's mine.
Is it your iPad there?
It's your iPad, Bill.
It may be the iPad.
Yeah. Teresa, while Bill's fixing his technical problems,
Okay.
can you introduce our next guest for us?
I sure will. It's my pleasure to introduce Mark O'Hearn. He's president and CEO of WVU Medicine East, and he's joining us this morning on the telephone. He's driving in, but he promised me he would pull over and not drive while the interview is going on. So, good morning, Mark.
Good morning. Can you hear me okay?
You're great. Yeah, you're
Wonderful. Yes, I promise I'm not driving. I am pulled over, Teresa. I followed instructions well.
He does.
Your volume is quite clear. We know you have a short time period open, so we'll get right to it. Mark, what do you know about renewed efforts in the House of Delegates and or the State Senate regarding Certificate of Need?
Yeah, no, I very much appreciate the time this morning, the opportunity to talk about CON repeal. I think it's just an important topic that everybody get very educated on. There's some substantial impact, I think, of a full repeal and opportunity just to talk about what the CON law does for the state of West Virginia and its residents is a great opportunity. I think many know that over 30 of the 50 states across the country have some sort of CON laws, and these laws are really designed to make sure that healthcare services are provided where they're needed most and not necessarily where they can be most profitable. And what I mean by that is the state can actually make sure that healthcare deserts, as they're called, or areas where we have critical access issues in rural communities, seniors, or low-income patients, really making sure that they will continue to have high-quality care. West Virginia has had CON laws since 1977. And actually in 2023 did enact some pointed changes within the law to enhance access. And that's really our position is that we need CON just like every other state. There's been several states that have tried to full repeal and actually have gone back and reinstituted CON because costs went up and services went down. So again, I'm happy to be here today and talk about it. Maryland, Virginia, which are our bordering states, they both have CON laws and they have no intentions on repealing those. So really our concern is that it's going to significantly create an uneven playing field in the market. Very commonly when there is no CON, for-profit entities will come in. They will specifically target commercial payer, which is a better paying insurance and generally helps us cover a lot of the unprofitable services that we offer. And the other thing I would say is that in West Virginia in particular, there's a lot of talk about open competition and free markets. The reality is about 75% of the patients that are cared for in the state of West Virginia, those payments are set by government entities, whether it's PEIA, Medicare, Medicaid. And so really the focus of repealing CON, many of those players will come in, they will specifically target commercial payers, and that will substantially impact our non-for-profit entities, particularly our critical access facilities, and services will be reduced. And that's really our position and the biggest concern of the repeal of CON. But it is certainly a significant topic. It's on the agenda. Actually, I was down in Charleston last night, had the opportunity to talk to many of our local delegates and legislatures about the topic. And so I'm always open to the conversation and the debate. I think it's a healthy one. But everyone needs to be informed of what a full repeal will do in the state of West Virginia.
Mark, what are the comparative statistics in our neighboring states, Virginia, Maryland, Pennsylvania, in regards to the number of people that are on a private health care system as opposed to in the state of West Virginia, where, as you mentioned, 75% are on basically a fixed payment system?
Yeah, very different. Lot higher commercial payer in those states. I don't have the exact statistics for you, but certainly the concern is that of the commercial plan members that we do take care of, it's a much smaller size of the pie. And so if we do allow for-profits and others from out of state to come in, it will be a substantial siphoning that will occur. And a lot of those profits, unfortunately, will leave the state of West Virginia as opposed to reinvesting, which is what we do with all of our funds that we have. We're a non-for-profit. We put hundreds of millions of dollars back into both our facilities, our staff, but all of it stays within the state of West Virginia.
Maria.
So do you think, we were talking about this off the air, Mark, obviously the healthcare committee on the House side defeated the CON bill very narrowly, 12-13. So this is coming back in your discussion with the legislators. How does that work? House side, Senate side, where's it coming from?
Yeah, I mean, certainly, obviously, we're in the beginning of session. Bills are coming through on a daily basis, rapid fire. The initial CON repeal bill was voted down, but obviously there's a lot more time in the session. It's an ongoing conversation. There are many, delegates that are on the fence, that are sort of undecided. And I think the beauty of the legislature is that there is a tremendous amount of educational opportunity. And they shared that with me last night, that it's been very helpful to really understand the impact. Healthcare, as you know, is incredibly complicated. And I think, what unnerves many is, I think tweaking CON, making very targeted changes that improve access and improve the care of West Virginians, as opposed to a wholesale repeal. And whenever you come in, in my opinion, whenever you come in and just fully eliminate a program as opposed to making thoughtful changes, you don't really appreciate the substantial impact that can have on the market. And again, as I point to other states that have done a full repeal, Wisconsin, Indiana are examples, and then they reinstated because they realized the full repeal was not the answer, making sure that they had targeted changes in their CON laws to improve access. And that's something that the state did back in 2023. And it made improvements in terms of birthing centers. It made improvements. There's a pilot on imaging, because imaging access was, not where we want it to be. And so I think those kinds of targeted impacts, again, I think the goal here is improving access for West Virginians, making sure that they have great care within their communities. And so I think the CON infrastructure can support that. I think a full repeal, frankly, is very dangerous in terms of destabilizing our rural communities and certainly our community hospitals in terms of offering comprehensive services, not just profitable services, but the unprofitable services that are essential, like emergency care, trauma, behavioral health, et cetera.
Bill?
Yeah. Good morning, Mark. You've made the point that the repealing CON would result in increased cost and poor service. And you also emphasize the medical deserts that we have in large parts of the state. These are compelling points, but a segment of the legislators are not hearing that. How much data do you have that will support your statements?
Yeah, I mean, there's a tremendous amount of, peer-reviewed data, published data. I would point folks to the West Virginia Hospital Association. They have an entire page set up with great information. I think you're right in that we do have medical deserts. I also think, though, that over time, as you have seen, we had this example where for-profits were able to get into West Virginia years ago, acquire two hospitals that were like 5 days cash on hand, and ultimately closed one, and another was picked up by a non-for-profit. The for-profits left. And so you sort of really get concerned about, again, folks that are not committed to West Virginia coming in, seeing an opportunity to disrupt the market, to make a margin, and how is that going to impact all of our vulnerable communities? And that's what my big fear is, both personally and certainly as a leader at WVU. We have been able to go into, across the state, you've seen it, a lot of these critical access facilities that were failing. They were very close to closing, and revive them and be able to serve. The concern, obviously, when you repeal fully CON is that you're going to expose those communities. You're going to have for-profit centers set up right across the street. They're not going to serve our government patients. They're going to serve and have a two-tier system, and they're going to pull a lot of that margin that we reinvest out of the state. And that's really the most important point I want to emphasize today. And you're right. You know, we have folks, I think, in the East, certainly delegate senators that feel strongly about a repeal, actively having that conversation with them, opening those conversations and providing that data so that they can, you know, ensure that they represent the community well. They make a great decision, you know, moving forward.
Mark, I know you're on a tight schedule. We promised to let you go early, so if you have any final thoughts, this is a great time to give them. If not, we appreciate your time this morning.
No, just urging all of our lawmakers and certainly those listening, think about the long-term impact of this. It certainly could have irreversible harm. Again, I'm a huge supporter of making revisions to the CON, but a full repeal I think is very, very dangerous. So, again, thank you very much for the time to give my opinion today. And I'm glad to talk to anybody that's listening if you want to reach out directly about the topic. Thanks again.
Thank you, Mark.
Thanks, Mark.
Thank you.
Mark O'Hearn,
Thank you.
President and CEO of WVU Medicine East. Teresa, this is not on in regards to CON, although I guess you could say it's some would say it's related to it. In regards to getting appointments and how quickly you can get service at the hospital for advance appointments or a new patient, someone just moving into the area. What's the access like at this time? Is it a challenge?
I would say it's an ongoing challenge, particularly with the primary care, and we hear this, you know, quite frequently, that there can be quite a wait for those folks trying to get into, if they've not been or don't have a primary care and need a primary care physician. That's where we're seeing it the most. But we are working very hard on that, and that is one focus since Mark's been here in early, he came in November 4th, actually. Mm-hmm. So that's been a top priority for him. So we've done some reorganization with all of our ambulatory, we call them ambulatory clinics, but our provider offices, our physician offices and clinics in the area, and we are working very hard on that to improve access.
Is that a matter of hiring additional physicians and techs and what have you, or is it related to other things?
Well, you know, if you look at our physician recruitment efforts, I mean, we're doing a great job. We recruited over 65 providers last year. We have about 68 different providers on our list this year. I think we've already confirmed about 20 of those. So I'd say it's probably a combination of, here we go.
And, excuse me, these 65/68, they are new positions or filling an existing position?
No, these in 2024 we recruited 52 new providers. Now that not just physicians, but also advanced practice providers. So,
but new positions. I'm not talking about a doctor. I'm talking about something that's not being addressed right now.
No. Providers, new providers. Yes, I was saying physicians, but yes, new providers. So we've already signed 14 new providers for 2025, and there's 68 total on our list. So, for example, and we do surveys and look at our needs assessments for the various specialties, but some of the specialties in 2025, cardiology, emergency medicine, endocrinology, family medicine, we have 12 on the list. Internal medicine, 2. So I'm looking at some of the primary care. Pediatrics, 3. But many, many different specialty areas. Gastroenterology, neurology, OBGYN, that's another one that we're focusing on. We feel we need 12 more OBGYN providers. 12? So, that's what we're looking for in 2025, yes.
And again, let me ask one question. My southern accent got in the way of my question,
okay.
I think. But these 12 positions, are they new offerings, or they are backfilling a vacancy?
Combination of both, I would say, Bill. But a lot of these, and especially in some of these specialty areas, are new because we've been adding new specialty areas, new service lines. For example, we just had a ribbon cutting for our bariatric and metabolic medicine service line, which we've not offered that before. We are getting ready. Well, we opened our neurointerventional radiology lab suite, and we will be having a ribbon cutting and open house for that soon, but that's allowing us to do a lot more with stroke care. Having those, and we did not have neurointerventional radiologists on staff before, so we recruited 2 new positions there. So some are new, but as I said, a lot, the family medicine, the internal medicine, I mean, those are just either backfilling for physicians who left, providers, let's say providers who left, or also we know there's a strong need to improve access in those areas.
We're blessed in this area to have 3 good hospital networks. WVU, obviously, Valley Health in Winchester, and also in Hagerstown. There's obviously competition. As far as capability and services, how do you think that we in WVU stack up compared to our neighbors?
Well, I've worked here before it was WVU medicine, so I can honestly say, and I've said this many times, nothing but good things have happened since we became a part of WVU medicine, that whole health network. And just to be able to say now, that we have the neurointerventional radiologists, that we have the bariatric specialists, that we have the allergy and immunology specialists, that we offer a full neurology service. Just to mention a few, I mean, it would have been difficult to do that, I think, if we were not part of the state's largest health system, WVU Medicine. So we're doing some great things over here. And surgery, our robotic surgery program. I mean, Jefferson Medical Center, which is a critical access hospital, has a Da Vinci robot. The surgeons at Jefferson Medical Center do robotic surgery. So, we are doing some great things here.
And you have a new president there, too?
We have a new president, yes. In fact, she starts on Monday, Nicole Dollison. She's coming to us from the Northern Virginia area. She's worked at GW Hospital. She's worked heading up behavioral health for HCA. So she has about 20 years of healthcare experience. So we're very excited to have her join us. And yes, her first day happens to be Monday. So Nicole Dollison. So we'll get her on the air once she gets in and gets settled. Right. So, but she's the new president and CEO at Jefferson Medical Center, and she will report up through Mark.
You were about to say, Maria?
Well, I was just the physicians, the providers that you were mentioning. Those are all working out of Martinsburg, correct? As opposed to because that's some of the things that we hear is how often do you have to go to Morgantown for the specialty work, and how many of them are basically right in our backyard.
They are right here in our backyard.
Okay.
And of the signature service lines that are offered in Morgantown, cancer, neurosurgery, and then heart and vascular, we have all 3 of those service lines here on the Berkeley Medical Center campus, or of course R&I is now up at Spring Mills, but in Berkeley County. And we opened last November a Heart and Vascular Institute office in Ranson on the 2nd floor of Jefferson Medical Center, and we plan to open this year a cancer and infusion center down there as well, so that folks for those services now won't even have to leave Jefferson County. They'll be able to have those provided there. But we're really trying to focus, and I'm sure if Mark were here, he would talk a bit about this. The focus is to really make Berkeley Medical Center more of a tertiary care center, so that, and Jefferson Medical Center will remain a critical access hospital, but we have some plans there too to, again, increase services and access to services, health services. But we really do want to try to keep folks here in the Eastern Panhandle for their care versus having to transport them out. But for that truly higher level of care, sometimes, unfortunately,
have to do.
Yeah, they'll have to. But we're trying our best to make sure that we can improve and increase access to some of these high-level services right here.
Teresa, it would not be an interview with you if I did not ask the question, how are we doing with the single patient rooms?
Well, I'm glad you brought that up, Bill, because we have two
You
major
anticipated,
projects
yeah.
that we're going for approval actually next month to the system board. One is a new patient tower at Berkeley Medical Center. That's about a $200 million project, but when completed, that would get us to all private rooms at Berkeley Medical Center and about 310 of them. So not only would it's going to increase the size, the bed size there, but also they would be all private rooms.
Right.
And then at Jefferson Medical Center, as I said, we had have some plans there too, as we talk about improving access to service and increasing services. We have a plan to expand at the current campus. To build some ambulatory service areas right there on the campus, including medical offices, have the physicians there, have all the services there, so that folks, when they need to, whether it's inpatient or outpatient care, that they can go to one site and have everything available for them. So you're going to be hearing more about both of those major projects. I think that one's going to be about a $60 million project.
Teresa McCabe, final couple minutes here. If you have other information you need to relay, this would be a great time to do it.
We have some fundraising events coming up I have to talk about. Of course, the Bernie Hutzler Golf Classic is Monday, June 2nd at the Woods.
About 3 months away.
And then, of course, we also actually, about a month away, we have our Children's Gala, our WVU Medicine Eastern Panhandle Children's Gala. That's at the Holiday Inn. We're pretty much sold out on that. We have a few individual tickets left, though, so if anybody's interested, reach out to me. But that's always a nice event, and all of that money goes to promote health services for our kids here in the Eastern Panhandle.
How do I reach out to you?
You can reach out to me by calling 304-264-1223 or email me at tmccabe@wvumedicine.org. I'm not going to give my cell phone number. Is that okay? Mark gives his cell phone number to everybody. I'm not gonna...
Are you doing the medical screening with Rotary again this year?
We are. That's May the 1st. Yes, we're going to do that on May the 1st, I believe, down on Tavern Road at our physical therapy and rehab. And, yes, you'll be getting more information about that. We haven't gotten the flyer ready, but, yes.
How's that retirement plan going for you?
It's still going.
Okay.
Still
Okay.
going.
Your date is still intact.
It is, I think. I'm not sure.
This is new.
Was that public information?
Yeah, I did not know.
They sent out a press release.
I
We're
didn't see it.
recruiting for a new vice president of marketing and communications. So actually, that interview process is taking. We're getting to the conclusion of that. So that announcement will be made probably within the next month or so. And then at that point, I'm going to move over and be the president of the WVU Hospitals East Foundation for a while
very good.
until I fully retire. Yes.
Well, Teresa, thank you very much for coming in.
Well, thank you for having me.
I never saw that press release.
Yeah.
So, have Maria
Some of
not
us
alerted
did.
us?
I'm on the insider track.
Apparently.
It wasn't
kidding.
a press release. It was just an email.
I think it was a text that Teresa sent to Maria.
Yeah.
You're going out when I'm going out, right?